Okay, I just need 16 minutes of your time. All right. First, what I want to do is have everybody stand up. I'm going to do a quick exercise off your cell phones. Come on, real quick. Real quick. Stand up. And turn to your left. Turn to your left. Now, it's really important you follow these instructions because it's a stress reliever. All right, if there's a person right in front of you, good. If not, move up to the person that's in front of you. Exactly. These docs right here in the third row got it. All right, so that's the first thing we're going to do right there. We're going to massage each other's necks. 10 strokes there, 10. All right, now you're going to... All right, now you're... Can you hear me? All right, now you're going to take your hands, you're going to chop. Chop. Yes. There you go. Not yet. Don't turn yet. Now take your hands and go down. Up and down. Midway, just go down to the middle of the back. All right, doing good. All right, now switch. Turn around. Turn to your other side. That's right.
You're good at it.
All right, chop. Chop up and down. Chop. You guys are right there. You guys are up. All right, hands down. All right, give yourself a hand. All right, now that I got your attention and you're feeling good, how's everybody? Good?
Better.
All right, so welcome, class of 218, right?
Yep.
You guys are almost there. Almost there. Can you handle the tooth or the truth? Anyone know what 410 stands for? Besides the area code? No? Anyone? No? In about 410 days, you guys are going to be doing this. No? What? Who said no? This will be you guys in about 410 days, right? But before we get there, we got to be thinking about what's after graduation, right? In preparation for graduation. And that's what I'm here to talk about, along with all the other presenters about the residency program. So I'm Dr. Hayes. I'm the program director, one of the program directors at Bronx-Lebanon. And we're going to talk a little bit about the program, give you an overview. We'll talk about the program setting, the patient base, the strengths, on-call policies, different types of procedures and some stats with that, some vitals, how you can come visit the program, some previous residents or actually previous grads. And if we have time, we'll do a Q&A either afterwards, after I speak, if there's not another speaker, or I'll be available outside, okay? So Dr. Gates is a program director. He used to be the dean at Fairleigh Dickinson Dental School, which was here in New Jersey, before it closed in 1990. When we started the program, he had 5 residents. Now we have 38. Yes, it's a lot. It's a lot, but there's advantages of that also. We've expanded up to about 62 chairs. We have 2 programs in addition to the GPR. We have a pedo program that started in 2001 and an ortho program that started about 4 years ago. Anyone interested in pedo and ortho? No? Just not telling anybody. Huh? I remember. We've had over 700 residents. Over 700 residents that have gone through our program. So we have a big database throughout the country. And in 2014, we opened up a new facility, which is like a little mini dental school. As far as the actual dental department, we have a staff of over 90. Faculty attendings close to 50. Most of us are full-time. About 80% of us are full-time, and you can see the breakdown: GPs, pedo, ortho, OMS, perio, and we have one of each in pros and endo. Patient visits. We see a lot of patients, all right? And that number has increased from 2013 to 2016. Over 93,000 patient visits. What do you guys think that means for you all as residents? Huh? Busy? Yeah. A lot of exposure. No shortage of patients. You know, right now you got 2 patients and one of them doesn't come in.
Yeah.
Yeah? One of the biggest challenges for a lot of new dentists making that change is going from 2 patients to 10 or 12 patients. But as a resident, you'll be able to transition into that very, very well. All right? So if there's one that doesn't come, you've got at least 2 or 3 that are just waiting to be seen in your chair. All right? 5 clinic locations, all of which kind of center around this home location, 1775. This is where you're pretty much going to be your home base. Okay? Oh, there's the mic. So there's 5 locations. Thank you. Fancy. 5 locations. All of them are about 10 to 15 minutes away from one another, usually by a shuttle, the subway, and also cars and parking. That's the new facility. As you can see, it's almost like a little big dental school, right? Like Rutgers of the Bronx, so to speak. So myself and Dr. Ubu, we are the program directors. Both of us are former residents of the program, and that's a theme that you'll see with a lot of the attendings and also a lot of the programs here, too. A lot of the faculty are past residents of the program. I've been in private practice prior to coming back to Bronx-Lebanon about 5 years ago. Also was in the Air Force. I had a practice in Houston and also in Los Angeles, and actually came back to the East Coast due to a family emergency, unfortunately, but came back and got reconnected with Dr. Gates to kind of give back to you all as new dentists. Dr. Ubu is also a former resident. She's pretty much in charge of our evidence-based dentistry program. You guys are doing evidence-based dentistry? Yeah. I know, but it's phenomenal. You guys will have the opportunity to kind of carry that on as residents at Bronx-Lebanon also. Okay? Program 70. We're about 15 blocks north of Yankee Stadium. Any Yankee fans? 1, 2? Okay. So we're also in an area that's in the South Bronx. We're in an area that's also designated as a health profession shortage area. All right. Access, like I said, we have 2 major subway lines that can get to the program off the Grand Concourse. If you're coming from Jersey, you get to take this dreaded bridge over to New York. All right. I don't drive. I live in Princeton, and I don't drive. I take the subway because the 3 times that I've driven to work, I get there in like 30 minutes, and then it's like an hour and a half over the bridge. So go figure. All right. But if you are coming, you're going to be living in Jersey, parking is limited in the areas where the clinics are located. So the patient base and the population, this is key to know because this is what drives the mission of the program, the patients that you're going to be seeing. We're in one of the poorest congressional districts in the country. Poor in the sense that it's a lot of patients have a lot of challenges financially and also with their health. Okay, greater than 80% are non-white. Greater than 70% speak Spanish. Anybody speak Spanish? Good. Wow. Well, you'll be speaking some Spanish at Bronx-Lebanon. All right. But we actually have a 6-week Spanish seminar that everyone is encouraged to take. Okay. A lot of managed care, a lot of Medicaid, a lot of uninsured patients in the sense that we are known as a safety net provider. All right. Because a lot of the patients that we see are on several different types of public insurance programs. All right? But we also have patients that come from the hospital, they're employees of the hospital, traditional insurance, fee-for-service, complex medicals, special needs, and geriatric patients also. Okay? Program strengths, I'm sorry for that slide, it's a little blurry there. But the program strengths is going to be you guys. All right? You guys from Rutgers, from University of Puerto Rico, from Howard, from University of Florida, from University of California, San Francisco. We have residents from all over the country, also from Canada, and also a fair amount of, with a handful of international students that have been dentists in their countries, have come to the U.S., going to dental school, and now doing residency. So that's one of the strengths of the program, the diverse resident population and coming from different schools and different ethnicities. The attending ratio, 1-to-1, all right? Instead of right now, you have to wait for Dr. Smith to finish with like all 5 of these people or 6 of these people. You're going to have more of a closer of like a 1-to-1 ratio in working with the attendings. Okay? Shared learning experiences, a 6-week Spanish seminar, mentor groups. This is really, really key and really important. I know some of the other directors talked about the importance of being able to collaborate with faculty. But we also, because of the size of the program, some people can get lost, whether they want to or not. All right? One of the things we make sure that doesn't happen, we'll put you in one of these 5 mentor groups where you'll be, that's headed up by faculty members and also the second-year residents or chief residents. And these are the people that you're going to be going to and checking in about your progress, also professional development, and they're going to be helping you with a couple of projects that you'll have also. All right? And then the last strength is the large numbers of the actual patient population that we talked about. There's never going to be a shortage of patients. All right? On call, yes, you will be on call. All right? On call is in-house, not your house, but at the hospital. Every year we get that question. Oh, can I take call from home? You can, but it has to be in the hospital home. All right? We have an on-call room. It's a buddy system. You're going to be one of 7 people on call representing the dental department. There are going to be 2 GPs, first years, 1 second year, 2 residents from pedo, 2 interns from oral surgery, and 1 oral surgery resident. So you guys represent anything above the shoulder, neck up, is when they call dental, and you'll be representing the dental department on those calls. Usually about 4 to 6 times a month. Again, it's only for 6 months. The way we have the program structured is broken into 2 6-month periods. When you're on call is the time that you're actually going to be on rotation. All right, so it's not a very heavy call. It's not heavy call at all. All right. You'll go through some hospital rounds with oral surgery. The next day you'll have a debriefing. If there's some patients that are actually in-house, you have a debriefing and also of what you did that night. We get a lot of OR experiences. Pretty much a lot of the procedures that you'll see on call deal with a lot of lacerations, some trauma, a lot of fractures. Okay? Procedures. What am I going to be doing residency? So this is just a breakdown, trying to give you guys an update, just some information about the different types of procedures. So these are the different types of procedures, pretty much the core ones. Endo, post-core, crown and bridge, removal, oral surgery, extractions. I'm sorry, I had a typo here that's not included. Implants. So for the most part, this is the range for the class of 15-16. Anywhere from 3 to 24. What you see here in parentheses were the high numbers. Of course, a couple of these were done by our second year, and our second year program is a little bit different. If I have time, I'll talk about that. But here's the average. So you can see endo, post-core, crown and bridge units, the total number of units. Perio surgery. Are you guys doing perio surgery now? It's not a requirement? Assisting? Okay. So at Bronx-Lebanon, we make it a purpose to make sure that you guys get at least 1 osseous surgery done. 1 osseous surgery, crown lengthening, surgical flat with osseous recontouring, something similar to that, all right? Now, as you can see, most people get at least 1. Some people have done even 4 or more. Extractions, a lot of experience with extractions. What's the actual requirement for graduation for extractions here? 40? Okay, and that's for third to second, second year, we don't want to go back. Third and fourth year, correct? So that 2-year period, you have to do at least 40 to graduate. So you'll probably be doing 40 the first 2 weeks of oral surgery rotation. So a lot of experience with extractions, okay? Implants, we're not a real heavy implant-based GPR as far as the placement. Placement is pretty much structured through oral surgery, but the residents get a lot more experience on the restorative side, okay? Again, it's just not enough time, guys, to teach you how to do implants correctly. Some programs may have more of an emphasis on implants than others. Ours is more of a comprehensive approach. You guys actually here at Rutgers and also NYU have a great 1 year, I think it's like a 1 year implant seminar. That's where you're going to learn how to really place implants and do a lot of the surgeries and learn the theories behind it. Case completions, this is pretty much start to finish on average from treatment planning to finishing the case. That's what that number is. And just overall, the top clinical rotational experiences that you'll see that have been reported by the residents, comprehensive care, pretty much what you guys are doing now, 3rd and 4th years in the clinics. The oral surgery rotations, where we talked about the extractions, and dental emergency rotations also. Program vitals, so we are a pass and a match program. That's our match number. Write it down, or you'll see it on the website later on. As I mentioned, 32 positions. I think we're the second largest. Montefiore, right up the street from us, has like 57. So it's a lot. All right. Salary. Everyone should be smiling right now. Salary, not tuition. Salary. All right. A little over $62,000. How much are you guys making? How much are you making right now? See, now you're smiling. All right. You also get some stipends with regards to expenses, book allowance. I think someone else mentioned it at their program. They have a book allowance. For the most part, that book allowance is being used by the residents for things like an iPad, iPhones, so that you guys can do your research. A couple of research projects that you will have during the residency. Health insurance also, okay? Vacation. You guys should be smiling again. Paid vacation. Paid vacation. You get 4 weeks paid vacation. 8 holidays. You get a couple of personal days. You also get some time, some leave for interviews. Some of you are going to be applying to programs, specialty programs, and also jobs. Also CE, and also board exam leave. You get 3 days for that also. Major deadlines is November 15th for the application, and we start interviews in October. Okay, a couple more slides. Just the emphasis, obtain experiences obtained across the entire spectrum of dentistry. We do have some technology that we're updating now currently. End of the year presentations, very similar to what you guys are doing or getting ready to do now with a topic of your choice. Lectures, we do have lectures and some of the technology that we have, the E4D and iTero. Site visit, it was mentioned before. You guys definitely encourage you, any of the programs, whether it's the ones that you see today or other ones that you're thinking about, you want to have the opportunity to go visit the program. All right? Not only find out more about them, but they can find out a little bit more about you. That's not going to be in your application. Maribel is our residency coordinator. This is the telephone number if you want to call and contact her. After July 20th is the best time. All right? By that time, we would have had the new residents oriented. This is the website address for that. I've passed out a couple of flyers. Here's a quick tour of what you're going to see when you come to the program and do the site visit. So the future is now, guys. These are a couple of graduates from Rutgers. This is Dr. Bloomer, who did a year with us 2 years ago. She's now our oral surgery resident at Temple. This is Dr. Rogers. same year with Dr. Bluma. I think he's moved now. I think he's out of New York. And then we've got 3 from the graduating class coming up in 17 that are coming to Bronx-Lebanon. In total, we had about 184 applications, did about over 100 interviews, and these 3 got 3 of the 32 positions. So who's next? Who's next? You? All right, that's my time. Thanks so much. If you have questions, I'll be available afterwards.
Yo voy a hablar con... Mira, yo voy a hablar...
Next we have former student Dr. Tran, graduated just less than a year ago, and now Dr. Tran is going to speak to us about Morristown Memorial's GPR program. Do you have a question?
Thanks. Sorry.
So they can still record it. Yeah, that's okay. We might still go. Thanks, man. Appreciate it.
Good. Well, I see some familiar faces here. So